some system of beliefs, and this is what really this is, right? This is a system of beliefs. I would have to make an appeal to this system of beliefs, this guiding philosophy. This guiding philosophy legitimizes the right, right? So the relationship between the right and, to be technical now, and I could do this more formulaic in an epistemology lecture, but the exercise of this right is itself wedded to a system of beliefs, right? The exercise of the right is wedded to a system of beliefs, makes sense, my right is wedded to a system of beliefs through the act of justification, right? It's through justifying my right that I appeal to an ideological system of beliefs that reinforces my that legitimizes my justification, right? So that the idea is, and you know, it's weird to take it this deep in a discussion of suicide, especially for a public lecture. This is a bit more advanced, but I never know who's watching the videos, and you know, especially graduate students, if I can put something out there, a little gem out there for them to capitalize on and incorporate in their research or their dissertation, then I've done my job. The idea is a discourse on suicide is complicated by the recognition, the institutional recognition of the right to commit suicide, but also the corresponding simultaneous attempt to limit the exercise of that right. The way in which that is potentially, the exercise of that right is potentially limited is by assessing the realistic nature of the attempt to exercise the right, right? How realistic is it that this patient wants to exercise that right? Let me inquire. The patient says, here's why I want to do it, and attempts to justify his or her right based on some system of beliefs. What ends up happening is the coherence of the system is going to be directly related to the coherence of one's justification. If the system says, in the case of Jim Jones, if you will, if the system says that you need to drink the Kool-Aid because we are blah, 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 whatever sort of ridiculous cult leader justification that's given, well, a good therapist can immediately draw out, distill the incoherence and potential contradictions within the system of beliefs. If the patient is a rational patient, then the incoherence and contradictions that inhere within the system of beliefs which justify the patient's right to suicide could potentially undermine the desire to exercise that right. Well, you know, I thought what I was doing made sense, but you know, after speaking with this person, I recognized the incoherence and the inconsistencies in my belief, in my system of belief, and I can't really justify the act anymore. I know I have the right to do it, but I can no longer justify exercising that right. Very, very nuanced. It's a hair thin distinction, and it's really, I mean, in a free public lecture, it's not, and I don't have the sort of group participation that I would have in a classroom, but it's very, very, very difficult to be able to identify specifically that pinpoint distinction between exercising the right, the justification of that right, and the attempt to limit it, right? It's very, very minute distinction. Hopefully that's clear though. Okay. Let me just make sure I get this right. Okay. So that explains that. So the idea between rational suicide and a realistic assessment, that should be clear. Okay, page 70, I want to read a section from page 70. It's the it's the first main paragraph. It starts with the role of the psychiatrist. All right, so page 70, full first paragraph. The role of the psychiatrist and the thinking of the rationalist tend to merge at one point. In the process of marshalling all the facts and exploring their meaning to the person, the psychiatrist must ensure that the patient does not indeed critically examine not only his perception of reality, but his own philosophy. This often entails making that philosophy explicit. Guiding philosophy. Making that guiding philosophy explicit. for the first time without ever using the term philosophy, and clarifying how it has influenced his life experience. Influence in terms of legitimization. How this guiding philosophy influences or legitimizes the patient's potential right to suicide. The implication is clear that modification of the person's view of his world with corresponding changes in behavior may lead to a more satisfying life. So that specifically then, this notion of modification or behavioral modification, we recognize that the legitimization of the guiding philosophy or system of beliefs influences, right? This influences the behavior, right? This legitimizes, this structure of belief legitimizes the behavior. In terms of suicide, what is the behavior? The behavior is actually exercising your right to kill yourself. Okay? If I want to modify the behavior, then, meaning that I, as a therapist, externally, don't want you to commit that act, the way in which, as we just read, this is facilitated is by causing the patient to look inward, right? Causing the patient to look inward to the structures and the content of his or her system of beliefs. That sort of introspection, that self-reflection, that in-depth analysis of, critical analysis of my beliefs will allow others into the justification, right? Here's how I justify it. Well, tell me a little bit more about how you justify it. Well, you know, I believe this and this and this and this, and I think that's what justifies. I think that system, that nexus, is what legitimizes me exercising this right. Therapist then realizes an access to the logical relations which justify the behavior. Since I want to modify the behavior, I then draw out from the justifications the generalizations and the hyperboles and the extrapolations which I think are inconsistent with rational, realistic life assessment. And I present it back from within the system. I present it back to the patient and I say, well, what do you think about, you said this and you said this, but don't you see how these things could be assessed in a different way? Have you thought of this? Have you thought of that? Wow, I never thought of that. Changes the behavior, right? So behavior modification doesn't begin specifically in habituation. I mean, you know, I'm not a shrink. You know, you read Pavlov's dogs and you know the story, sort of behavior modification as a physiological sort of redundancy and act. Sure, human beings are a lot more complex. A more systemic way of modifying behavior isn't just sort of muscle memory and training. I don't know what muscle memory relates to the desire to exercise one's right to suicide. Therefore, for at least logical, rational patients who are seeking some type of therapy, there is a cognitive, which is also physiological, let's keep it real. There's a cognitive means of behavior modification by identifying and bringing to the fore the logical inconsistencies in one's systems of belief, right? So if you can bring that, it's not an easy thing to do at all, but if you can bring that to the fore and the patient is willing to allow you access into their nexus of justifications, then you can modify and prevent the exercise of that right by drawing to the forefront the contradictions, right, and the inconsistencies. Okay, so reducing the stigma of suicide then, sort of last section. Here's a direct quote from the book, page 71. The suicidal act is not considered respectable in our society. Okay, it's not. It can be maintained, well, in the West, right? It's definitely not. And in most places, suicide isn't considered West. There's a huge, and it would be interesting to look at the distinctions between the West and the East in terms of suicide. And I'm sure it's been written. The suicidal act is not considered respectable in our society. This is a quote. It can be maintained that granting a right but stigmatizing the exercise of that right is tantamount to not having granted it in the first place, right?